Which of the following investigations can help distinguish between neurogenic and arterial claudication that is intermittent? A. Doppler flow studies. B. Digital subtraction angiography scan. C. All of the above. The horizontal squares on an EKG measure what? A. R wave. B. Duration. C. Voltage. D. Q wave. What are a few third-degree AV block causes? A. Age, digitalis intoxication, or myocardial infarction. B. Hypertension, coronary artery disease, and cardiomyopathy. C. Certain drugs, such as quinidine and atropine. D. Heart disease and damage from uncontrolled diabetes mellitus. Which of the accompanying set of ailments is connected with valvular coronary illness? A. Systemic lupus erythematosus, syphilis, Marfan syndrome, carcinoid syndrome. B. Amyloidosis, tuberculosis, Sjogren's syndrome. C. Rheumatic fever, collagen vascular ailment. The medical attendant gets the blood test reports for a patient who was conceded to healing facility with dissensions of midsection torment. The report indicates a raised level of CKMB. What does this report imply in this patient? A. Damage to myocardium. B. Damage to intercostal muscles. C. Liver damage. A patient of peripheral arterial disease is being discharged from hospital. What guidance ought to be given by the medical caretaker about foot care? A. Clean feet utilizing delicate scrubber and keep dry. B. Clean the foot by rubbing with pumice stone. C. Wash and saturate feet every day, wear thick socks and agreeable shoes. In which cardiac disorder does blood flow backward from the left ventricle into the left atrium during systole? A. Aortic stenosis. B. Mitral regurgitation. C. Tricuspid stenosis. D. Pulmonary regurgitation. A patient presents with intense arterial occlusion of one of his upper limbs. Which of the accompanying pills ought the attendant plan to direct to the patient? A. Warfarin. B. Heparin. C. Streptokinase. A patient is wearing Holter screen. What guidelines ought the medical caretaker provide for take after throughout following? A. Stop all his standard medications. B. Maintain an action journal of his physical activities. C. Restrict physical activity. Which electrolyte condition will reveal shortened QT intervals and cardiac repolarization on an EKG? A. Hypocalcemia. B. Hyperkalemia. C. Hypokalemia. D. Hypercalcemia. Which of the following statements about AT wave is true? A. Prominent peaks may indicate myocardial infarction or hyperkalemia. B. Is normally perfectly symmetrical. C. Frequently hard to detect in a normal EKG. D. Suggests ischemia if inverted. Which kind of atrioventricular block patient in particular would be a good candidate for a pacemaker implant? A. Transmural ischemic blocks. B. Posterior fascicular block. C. Third-degree block. D. Hemi blocks. Which of the following is a common symptom of angina pectoris? A. Shortness of breath. B. Chest pain or discomfort. C. Abdominal pain. D. Joint pain. What is the primary mechanism of action of beta blockers in the treatment of heart conditions? A. Vasodilation. B. Positive inotropy. C. Negative chronotropy. D. Calcium channel blockade. Which imaging modality is often used to assess cardiac function and diagnose structural heart diseases? A. Magnetic resonance imaging, MRI. B. Positron emission tomography, PET. C. Computed tomography, CT. D. Echocardiography. What is the normal range for the left ventricular ejection fraction, LVF, in a healthy adult? A. 30 to 40%. B. 50 to 60%. C. 70 to 80%. D. 90 to 100%. Which condition is characterized by the accumulation of fluid in the pericardial sac, compressing the heart? A. Pericarditis. B. Myocarditis. C. Endocarditis. D. Cardiomyopathy. Which medication is commonly used for anticoagulation in patients with atrial fibrillation? A. Aspirin. B. Warfarin. C. Clopidogrel. D. Digoxin. What is the preferred initial treatment for acute ST segment elevation myocardial infarction, STEMI? A. Thrombolytic therapy. B. Coronary artery bypass grafting, CABG. C. Percutaneous coronary intervention, PCI. D. Beta blockers. Which lipid-lowering medication inhibits HMG-CoA reductase, a key enzyme in cholesterol synthesis? A. Ezetimibe. B. Gemfibrozil. C. Atorvastatin. D. Niacin. What is the first-line pharmacological treatment for stable angina? A. Nitroglycerin. B. Beta blockers. C. Calcium channel blockers. D. ACE inhibitor. Which congenital heart defect is characterized by a connection between the aorta and pulmonary artery, resulting in a mixing of oxygenated and deoxygenated blood? A. Atrial septal defect, ASD. B. Ventricular septal defect, VSD. C. Patent ductus arteriosus, PDA. Which medication is commonly used to reduce preload in heart failure patients by promoting diuresis? A. Spironolactone. B. Furosemide. C. Metoprolol. D. Enalapril. What is the primary purpose of an implantable cardioverter defibrillator (ICD) in patients at risk for sudden cardiac death? A. Rate control in atrial fibrillation. B. Prevention of bradycardia. C. Termination of ventricular tachyarrhythmias. Which antiplatelet medication is often prescribed following percutaneous coronary intervention, PCI, to prevent stent thrombosis? A. Clopidogrel. B. Aspirin. C. Dabigatran. In hypertrophic cardiomyopathy, what structural abnormality is commonly observed in the myocardium? A. Dilated left ventricle. B. Thickened interventricular septum. C. Aneurysmal right atrium. D. Aortic valve regurgitation. Which type of heart block is characterized by a consistent delay in the conduction of electrical impulses from the atria to the ventricles? A. First-degree heart block. B. Second-degree heart block, type 1, Wenckebach. C. Second-degree heart block, type 2. What is the primary role of nitrates in the management of angina? A. Inhibition of platelet aggregation. B. Vasodilation and reduction of preload. C. Positive inotropic effect. D. Reduction of heart rate. Which antiarrhythmic medication is a class 3 agent that prolongs the action potential duration and is used to treat atrial and ventricular arrhythmias? A. Amiodarone. B. Lidocaine. C. Procainamide. What is the most common cause of acute pericarditis? A. Bacterial infection. B. Viral infection. C. Fungal infection. D. Parasitic infection. Which condition is characterized by a sac-like bulge in the wall of a blood vessel, often the aorta? A. Aneurysm. B. Dissection. C. Stenosis. D. Regurgitation. Which laboratory test is commonly used to monitor the therapeutic effect of heparin? A. Activated partial thromboplastin time, APTT. B. Prothrombin time, PT. C. International Normalized Ratio, INR. D. Platelet count. What is the primary goal of cardiac rehabilitation in patients with heart disease? A. Weight loss. B. Blood pressure control. C. Smoking cessation. D. Improvement of cardiovascular function and quality of life. Which imaging technique uses radioactive tracers to assess myocardial perfusion and viability? A. Echocardiography. B. Nuclear stress testing. C. Coronary angiography. D. Cardiac magnetic resonance imaging, MRI. What is the most common cause of aortic stenosis in developed countries? A. Rheumatic heart disease. B. Bicuspid aortic valve. C. Congenital anomaly. D. Atherosclerosis. Which medication is commonly used for rate control in atrial fibrillation and atrial flutter? A. Amiodarone. B. Digoxin. C. Diltiazem. D. Metoprolol. In heart failure patients with reduced ejection fraction, which medication has been shown to reduce mortality and hospitalizations? A. Hydralazine and isosorbide dinitrate. B. Furosemide. C. Dobutamine. What is the primary mechanism of action of angiotensin-converting enzyme ACE inhibitors in heart failure? A. Vasodilation. B. Positive inotropy. C. Aldosterone inhibition. D. Negative chronotropy. Which condition is characterized by the accumulation of fluid in the alveoli and interstitium of the lungs, impairing gas exchange? A. Pleural effusion. B. Pneumonia. C. Pulmonary edema. Which congenital heart defect is characterized by a hole in the septum between the atria? A. Atrial septal defect, ASD. B. Ventricular septal defect, VSD. C. Patent ductus arteriosus, PDA. D. Tetralogy of Fallot. What is the primary purpose of a coronary artery bypass graft, CABG, procedure? A. Repair of heart valves. B. Removal of plaque from coronary arteries. C. Restoration of blood flow to the myocardium. D. Closure of septal defects. Which medication is commonly used as an antiplatelet agent for secondary prevention of cardiovascular events? A. Clopidogrel. B. Warfarin. C. Aspirin. D. Heparin. What is the primary mechanism of action of statins in the management of dyslipidemia? A. Inhibition of cholesterol absorption. B. Promotion of bile acid excretion. C. Inhibition of HMG-CoA reductase. D. Enhancement of triglyceride synthesis. Which type of heart failure is characterized by a preserved ejection fraction? A. Systolic heart failure. B. Diastolic heart failure. C. Right-sided heart failure. D. Left-sided heart failure. Which antiarrhythmic medication is a Class IA agent that is effective in treating atrial and ventricular arrhythmias? A. Amiodarone. B. Quinidine. C. Lidocaine. D. Flecainide. In the context of cardiac catheterization, what is the purpose of coronary angiography? A. Measurement of blood pressure in the coronary arteries. B. Assessment of myocardial perfusion. C. Visualization of the coronary arteries. D. Evaluation of cardiac electrical activity. Which medication is commonly used for rhythm control in atrial fibrillation and atrial flutter? A. Digoxin. B. Amiodarone. C. Metoprolol. D. Diltiazem. What is the primary purpose of beta blockers in the management of heart failure with reduced ejection fraction? A. Vasodilation. B. Positive inotropy. C. Negative chronotropy. D. Aldosterone inhibition. Which electrocardiographic finding is characteristic of atrial fibrillation? A. Prolonged PR interval. B. Sawtooth-shaped P waves. C. QRS widening. D. Delta waves.